Obsessive-compulsive disorder. Obsessive-compulsive disorder is part of the emotional and behavioral disorder category of IDEA. According to Smith, the federal definition of an emotional disturbance includes an inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behaviors or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms related to fears associated with personal or school problems. Obsessive-compulsive disorder falls into this category because students who have it do not always act and feel the way their peers do. Typically, thoughts and feelings lead them to act in abnormal ways. Lots of them perform rituals to quiet their minds because their minds are so active. The state definition for New Jersey is the same as the federal definition for emotional and behavioral disorders. OCD is defined as unwanted thoughts, which are the obsessions, which then lead to repetitive behaviors, which are the compulsions. And students who suffer from this need to come up with coping mechanisms to calm and quiet their minds in order to focus on everyday activities. In some cases, students are slowed down by this because they feel the need to make sure everything they hand in to their teacher is perfect, or sometimes they may struggle to read quickly. For example, they may think that they need to read every sentence 3 times before they can move on to the next sentence. So in that respect, it can slow them down quite a bit in school. To diagnose obsessive-compulsive disorder, it's important that doctors understand the definitions of obsessions and compulsions. So obsessions include thoughts that are very repetitive, they won't go away, and those thoughts lead to urges to find a cure almost for the obsessions that the students may be having. So in some cases, students may be seeing pictures in their head of negative things, and that causes them to worry. So the person will try to stop those images from being in their head, and that leads to what compulsions are, which compulsions are the rituals or the behaviors that are caused by the obsessions. So in a sense, obsessive-compulsive disorder is a cause and reaction title because the obsessions are what cause the compulsions to occur. The behaviors that the compulsions include could be anything from tapping loudly or saying a word over and over in their head, or keeping a hat on because they're worried that if they take it off, something bad will happen. And these compulsions are not always rational, which is part of the problem that some students with OCD have. So the doctor's first step in diagnosing OCD is to find out how severe the case is. A great resource for finding the severity of the case is the Yale-Brown Obsessive-Compulsive Scale. So patients would take a test or talk to their doctor, and the doctor would see where they fall on that scale, and from there they would evaluate how much medication or what the best course of action for their treatment would be. The next step the doctor has to do is have the patients complete the mental status examination, because in a lot of cases of people who have OCD, they tend to have another disorder that goes along with it. So the mental status examination helps the doctors see if there are any symptoms that correlate with another disorder, and then they can diagnose the other disorder and find the best treatment for that patient based on the one disorder that they have or the multiple disorders that they may have. Developmental characteristics of students who have OCD include physical characteristics, which the biggest physical characteristic of someone who has OCD is exhaustion. Because what happens when they have obsessive-compulsive disorder is they obsess and they worry about a particular thing, whatever that thing may be. Sometimes there are things that trigger them, sometimes at school or outside of school. Sometimes they come in already a little anxious. because OCD is tied directly with anxiety. And from there, they spend a lot of their time either trying to hide the fact that they're coping with the thoughts that are irrational that they're having, or they're openly coping with it, but the exercise and ritual that they're making themselves do to cope with it is tiring to them. So some people have to walk over the threshold of a room multiple times before they enter the room, or they think something like the ceiling may fall and hurt all the people in the room, and then that person would be responsible for hurting all those people because they didn't walk across the threshold so many times. So this can be very repetitive, very redundant, and very tiring. And another thing that causes exhaustion that's tied with OCD is current panic attacks. Students who have OCD tend to, if they let it get out of hand, if they aren't doing well finding their own coping mechanism, they can break down a little bit and their body starts to shake and it's uncontrollable. So they're dealing with hiding their disability, they're dealing with coping with their disability, and in some cases when they can't cope or hide it, that is the most exhausting thing that can happen to them because it leads to a panic attack, which is certainly a physical reaction. In some cases, like I mentioned before, they may alter their physical appearance as one of the rituals. Like, for example, there was a case of a woman who, I had mentioned this earlier, she wore a hat for several weeks because she believed that if she took her hat off, something bad was going to happen, like something was going to fall and hit her on the head. So the hat, in a way, was kind of protecting her from that happening. So that's just a way that their physical appearance may be altered also. The biggest emotional characteristic for students with OCD is fear. They battle fear with just about everything they encounter that could be perceived as violent or scary in some way. So, for example, students who have OCD tend to avoid watching violent videos because in that case they become afraid that either they are going to become violent themselves or someone is going to act in a violent way toward them. And it's especially scary for them when they can read books or when they can see the behind-the-scenes mentality of someone who's violent, because they then obsess about those thoughts that they read about, and they wonder if they're going to become violent because now they know how one can go about being violent toward others. Or they wonder if someone is plotting, like the person they read about, how to harm them or how to harm people they're close to. So in a way, they're kind of living in fear all the time. And they're also afraid of what their peers and superiors may think of them because of the reactions that they have to things that seem like everyday things to people without OCD. But to them, it's hard to move past some of the things that they see on TV or read in books. So we call those things triggers, the things that may cause them to act out or worry. For the social aspect of development, the biggest thing people with OCD battle is loneliness, because they find that being around people is exhausting to them because of the reasons I mentioned before with the physical characteristics. They're trying to hide their triggers, they're trying to hide their coping mechanisms. So when they're with people, they feel like they can't necessarily be themselves, and so they enjoy their alone time, which is a good thing and a bad thing, because it's good to have time to yourself, but it's bad, especially at the younger ages when they're developing, because that's a time where they can really learn from their peers. Any young child can learn from their peers, and if people with OCD are kind of excluding themselves just to avoid becoming so exhausted, that can lead to being lonely as an adult and maybe not being able to relate to their peers as well as they get older. And they also are living in fear kind of what their friends are going to think of them. So in some cases, people are made fun of for their coping mechanisms and their rituals. And in other cases, they're just worried that they're a burden to their friends because they have all these things that set them off. They have all these reactions that they can't really control, or reactions that they try so hard to control. And that leads to their friends maybe being a little embarrassed about how they're acting in public or something like that. And people with OCD are very aware of this, and they worry that their reactions are embarrassing to their friends and that their friends aren't appreciating them for who they are. So that's another reason why they sometimes choose to be alone. For the cognitive developmental characteristics, because OCD is a mental disorder, it's an emotional trigger, a lot of the problems that people have are with their minds. So OCD is an inability to move past a thought or idea without analyzing it for a long period of time. And in the case of people with OCD, their mind always has to be focused on something and active. And if it's not being used for something productive, it goes on to cause its own problems and stresses. And students with OCD develop at the same pace as their peers, but they may even be developing a little bit faster because their minds move past everyday tasks so quickly and just go straight to where can I make things a little more complicated for myself, where can I put more obstacles in my mind's way so that it can overcome them, so that it can definitely stay active. And they sometimes pull themselves away from thinking about the simple things that their peers are able to acknowledge and move on from. And instead they dwell on small things, and their minds convince them that something negative is going to happen if they do not perform their rituals. And that is a negative thing, just because it's hard for them to act the same way as their peers because of the way their mind is developing. Students with OCD are very high functioning though. They're usually some of the brightest students in a class, and sometimes that doesn't always show because maybe they have a hard time handing in their homework, or maybe they have because they are so worried about making sure that their handwriting on it is perfect and everything is lined up perfectly and their argument is set perfectly and every math problem is done correctly. And in that case, it becomes exhausting for them again, and they tend to only be able to do homework in smaller doses. But typically, students with OCD don't have a problem participating in class and speaking and showing what they know. They just may be slower to hand in work and be slower to show the teacher that maybe they understand everything that's going on because they're so wrapped up in their own mind's activity. So strengths and challenges of students who have OCD. Strengths are definitely that students who have OCD are extremely intelligent and they're very self-aware. So students with OCD know what triggers them, and in knowing what triggers their maybe not so positive reactions, they can understand and they can avoid those things that trigger them, and they become experts on themselves, more so than students who don't know what necessarily is going to affect them in a negative way. Students with OCD are very, very aware of how they're going to react and what is going to cause them to react that way. They then avoid those types of things, and that can lead them to becoming more successful in not having bouts with OCD, not performing rituals, because they can then avoid what will cause them to obsess, and then compulsions won't be necessary because they won't be obsessing. Some challenges that students face, like I mentioned before, they may not be able to hand in work on time. They may be a little bit slower with reading, and it's not because they have a problem with their comprehension or their speed. It's because they feel the need to repeat things. Sometimes people with OCD are very concerned with numbers. So if my number is 3 and I have OCD and 3 is always the number that I'm going to come back to, then I'm going to have to, cross the threshold of a room 3 times before I walk in, or I'm going to have to read a sentence 3 times before I move on to the next one. And in some cases, students pick high numbers. The woman I read about, her number was 6, so she would do things in pairs of 6, and that clearly can slow a student down and make it harder for them to move forward at the same pace that their peers are moving forward. They panic frequently because, again, if they have something that triggers them, it won't go away just in a day. Usually it takes them a long period of time, maybe even a week, for them to move past a thought, depending on how bad or disturbing the trigger that they encountered was to them. So if they're worried about becoming violent, and they're worried that everything they hear is translating into a violent way, and they're worried that they're going to act out in a way that they saw on TV or they witnessed or read about, they're going to be panicking because they know that violence is bad and they know that that's not who they are, but at the same time they're worried that they can't control themselves. So that is another challenge that they face. And again, just a pretty basic challenge is just hiding all of these things, because students with OCD feel that they will not be accepted if they act completely 100% as themselves and they show all the rituals that they perform. They're very concerned that people will judge them and not accept them in society. So it's a big challenge for them to constantly be hiding what comes naturally to them. Some accommodations for students who have OCD include decreasing the homework load for these students, because, like I said, they tend to do things a little bit slower, and in seeing a large pile of homework that they have to complete, it also overwhelms them and causes them to shut down a little bit and not be able to get any of it done. So as a teacher, it's better for you to get work from these students in small doses, but definitely be getting it, rather than give them a lot all at once and have them not hand any of it in. Because this way you can kind of gauge how well they're understanding, and you can see how intelligent they are because they're completing the work on time, because they can keep up with the class. Because they are capable of keeping up with the class, they just slow themselves down in some cases. Another great tool is to arrange the seating in your classroom, because depending on the case of OCD, some students may not be able to focus if they can hear things outside of the classroom. So in their case, you wouldn't want them sitting close to the door to the hallway or close to a window where there may be people making noises that are not related to your class, because then they'll lose focus, and then that can lead to obsessing about, oh my gosh, I'm not paying attention, or what did that person just say? Did I hear something bad? And then that can lead to them compulsing and performing rituals that then become distracting, not necessarily to their peers, but to them. You want to make sure that everyone in your classroom is focused, including the people who have a harder time focusing. So if students know that they get distracted easily, they should be placed towards the front of the room, towards where you're standing, towards where you're going to do most of your lecturing, just so that they can hear you, and you are the primary voice that they're hearing. But in some cases, students want to be able to perform their rituals, and they want to be able to not have other people staring at them. So in their case, they would not want to be sitting in the front of the classroom. They would want to be closer toward the back, so that way they know that no one is staring at them, and that way they can avoid becoming exhausted with trying to hide their rituals and the things that they feel they need to perform. And they can just do those things quietly on their own while also paying attention and hearing you, and not worrying about judgment from their peers. Another accommodation that is very good for people with most disorders, but especially people who have OCD, is just more time for tests, because again, part of OCD is wanting to perfect their handwriting, wanting to perfect their answers, wanting to make sure that everything is as close to perfect as possible, and that takes a lot of time and a lot of energy for these students. So just giving them more time so that they know that they're not under a lot of pressure to get things done, and because the pressure itself forms as a distraction to them, and then that can lead them to have rituals that they need to perform again, and that'll just slow them down more, and then before they know it, they've only gotten half the test completed. So in knowing that they have as much time as they need, they can take their time and they can produce the best test for you and for them. Teachers need resources too, especially when they're dealing with a disorder that they may not be as familiar with as some other things that students may have. So one great resource for teachers is school guidance counselors, or just regular counselors in general. If a teacher is having a student act in a way that they're unfamiliar with, and the student has not come in and been diagnosed with anything in particular, one thing a teacher can do is have a school counselor come in and kind of observe the behaviors of that student and maybe get their thoughts on what it might be, and then contact the student's family and say, maybe they have something that's going on that's preventing them from being the best student that they can be or producing the best work that they possibly can. And, you know, a counselor has recommended that maybe they go to the doctor and get tested for this certain disorder. Or if this teacher knows that the student has OCD but has no idea about OCD or how to work with somebody who has it, a counselor who is familiar with this disorder can kind of give them some tools, give them some resources that they can use to learn more and educate themselves about how to go about reaching the student. One resource that a counselor may provide is websites, particularly the Council for Exceptional Students website, because this website has information about all kinds of disorders and about what to expect from a student who has this disorder and how to go about reaching them. And this website also has tons more accommodations that a teacher can give to a student who's having a hard time with keeping up in the teacher's class. A huge part of teaching is collaboration with other teachers. And because every student is different, a teacher can research a disorder so many times, but that will not help them 100% with reaching a particular student unless they know what sorts of triggers set off that student. So the best way to find that out is to talk to a teacher who's had this student in their class, and that way they can say, look, if you put on a movie that has violence in it, this student is going to have a really hard time moving past that, and they may even become panicked, and they may have to leave the room because they can't stop panicking and they can't calm themselves down. So if you have to show a violent video, maybe just take that student aside and have them do an alternative assignment instead of watching the video, because that's going to cause a problem. It's things like that websites and books can't necessarily help you with, because they don't know the particular student that you're dealing with. And teachers who have had this student in the past do know them better than a book or a website can tell you. So it's very important that teachers are proactive and talking to their colleagues about how to best reach individual students. Another great resource is reading books and memoirs written from the perspective of someone who has the same disorder as the student that you're trying to reach. Because this way, you'll gain empathy and a new perspective, and you'll understand their mindset, and that can prevent you from becoming as frustrated as you may be if a student's not cooperating with you, or maybe a student who's doing really well in your class, but all of a sudden they stopped handing in homework assignments, and you want to know why. Reading books from the perspective of someone who has the disorder will give you great insight into that, and it will help you become a better teacher and a more well-rounded person. And finally, the International OCD Foundation is a great resource because it's for everyone involved in the life of someone who has OCD. So it describes what OCD is, and it also addresses the family in one of the tabs on the website about how to work with their child. And in doing that, you can understand kind of a parent's perspective, because you may have to work with parents of a student who has OCD, and you may not understand where that parent is coming from in a lot of respects, but in reading the same materials that those parents are going to be reading, you will understand a little bit better their perspective, and you'll also understand again just how to reach the student, because the more resources you use, the more you will understand, because each resource is written by somebody different. So you're going to be gaining many perspectives by using multiple different resources and mediums to understand your students. The cause of OCD is mostly unknown, but there are two theories about how OCD came about. And one of the theories is actually very interesting because it's linked with childhood strep throat, because the strep throat infection can trigger an autoimmune response in the body that can cause symptoms of OCD. Because OCD is a neurobiological disease, there's something called beta-hemolytic streptococci, which is the bacteria that causes strep throat, and it's associated with changes in the brain chemicals and patterns of responsiveness to things like glucose, and the metabolism, and they're triggered by an autoimmune reaction. So because the brain is affected when it's developing at such a young age because of this bacteria from the strep throat, that can lead to OCD developing later on because the responses in the brain have been altered in some way. The other theory is that people with OCD have something called an excess of the neurotransmitter serotonin, which serotonin is kind of what makes your brain so active. It's one of the things that really, it keeps you on high alert, and people with OCD, the theory says that they produce serotonin more and quicker than the HSERT neurotransmitter can collect it, because that neurotransmitter is responsible for kind of mopping up the excess serotonin in the brain. So students who have OCD tend to have an excess of serotonin, which explains why their brain needs to be so active all the time. And that is just another theory that they have. But again, there is no known, defined, definite cause, but these are just some of the things that may cause OCD. So, what to take away from all of this is that as a teacher, you need to understand that obsessive-compulsive disorder cannot be completely controlled. And it's hard for somebody who doesn't have it to put themselves in the shoes of somebody who does have it and understand that I am obsessing about something, but I can't stop. And I am going to jump up and down or reread something multiple times because I think that that affects what I'm obsessing about. And it seems silly to some people because these activities that they're doing make them stand out and make them look different, but they can't control it. These compulsions and rituals that they perform are coping mechanisms to quiet their minds, and their minds are so active and so on high alert that it's just something that people who don't have OCD can't really understand. But it's something that you need to be empathetic about as a teacher, and you need to be aware of what a student with OCD's peers are saying also. And you need to kind of stop it if they're saying negative things about their classmate who has OCD. Another thing you should understand is that it's very frustrating for the students who have OCD because they're very intelligent and they know that what they're doing is out of the ordinary, and they know that what they're doing may look funny to their peers, but it's something that they have to do to be able to live with themselves and to be able to deal with their own minds. And they try so hard to hide their rituals and to control their rituals, but in some cases they can't be controlled, and in some cases if they try to control it too much, it can lead to panic attacks, which is not something that they enjoy having, and it's not something that they're doing just to get attention. It's something that they wish they could stop, but they can't. One thing that's a very common misconception about obsessive-compulsive disorder is that it's this need to be clean and have everything organized. So you'll hear a lot of people say, oh, I have OCD, just because they want to separate their red M&Ms from their yellow M&Ms. And that's not what OCD is at all. It's not washing hands so many times that just because they're afraid of germs. Those things are part of it, but that's not the actual brain function that's going on behind obsessive-compulsive disorder. Students may wash their hands a lot because they're afraid of germs, but there's a deeper cause for that. They're afraid of germs because they've seen something on TV that says that there's a fatal bacteria going around, and if they touch the floor and then their face, they're going to get this bacteria and they may die. It's that type of brain state, it's that type of mental capacity that's causing them to wash their hands frequently. It's the fact that they want everything to be organized, they want everything to be the same number, because that gives them a relaxation, that gives them a sense that everything is going to be okay, not just because they want it to look better. So it's a common misconception, and OCD is kind of a term that's thrown around very loosely, and people don't understand exactly what it is and how tormented the people who have OCD can be in a lot of cases. As a teacher, it's very important that we just have patience and understanding for the students who have OCD, because they may be a little bit slower than their peers. They may require a little bit extra attention, but they are listening and they are hearing what you're saying as the teacher, and they want to be great and they want to get better. And most of the people with OCD go on to go to schools for their higher education that are very well esteemed colleges, and they go on to do great things, and they go on to write very well or be very good at the math and sciences, and they need to be given that chance though. And the best way to do that and the best way to understand them is just to listen to them, to hear what they're saying, to hear what they're going through, to give them the extra time that they need on assignments, and to research and find out the best ways to reach these students. Another thing that teachers need to understand is that families don't take the diagnosis of OCD well a lot of the time, because parents are frustrated just the same way that a student's peers or the same way a teacher may be frustrated, in that the student knows what's going on and they're very aware, but for some reason they have to do these things that make them stand out in a negative way. And parents who don't understand that can be very harsh on their children and can snap at them. The book I read, written by a woman who has OCD, said that, she described her dining room table as a war zone because her dad would constantly be on her. Why are you doing that? Why are you acting this way? Why are you saying these things? Why are you mumbling? Why are you counting all the time? Why are you doing these things? And he couldn't understand it. And it was frustrating to him because he wanted his daughter to fit this picture that society has painted about what's normal and what is fitting in. And he just could not understand why she couldn't stop herself from doing these rituals. So it's very important that the teacher is empathetic toward the student, and that the student does not feel like school is a place where they're going to be judged, and they should not be describing school as a war zone, especially if they describe their own home lives as war zones. So it's important that the teacher is a resource for that student to talk to and discuss what they're going through and how they're feeling. And these are my references. I hope you've learned a little bit about OCD, because I know from doing this project, I certainly have. Thank you.